Hi, Dr. Jarmel. I'm Dr. Mancuso. It's really nice to meet you.
It's nice to meet you as well.
I'm so happy to be here. Your clinic is beautiful.
Thank you. I just have a couple questions for you. To start off, why don't you go ahead and tell me about yourself?
Well, I graduated from IFIC College's DPT program, so I'm a doctor in physical therapy. I've really come to love working in the field of physical therapy, and I really admire what goes on and how much our career and that population is expanding. I really see myself working with neuro patients. I've had a little bit of experience in some of my clinicals, and so I really see myself working in a facility like yours.
Wonderful. How about your strengths and weaknesses? Can you tell me a little bit about those?
Well, I love working with people. It's something that I've always been really good at. I feel like I'm a friendly person, and I get along with others, and playing team sports throughout the years has really gotten me better at working with others, so I think I'm a good team player and a good team leader. I'm also pretty laid back, but also highly structured, so I think that balance really enables me to get the most out of career experiences and life experiences. My weaknesses, though, I'm always trying to improve my ability to walk into an initial eval without any bias or stereotyping that person. I had some CIs give me advice about maintaining an open mind regardless of the diagnosis, regardless of how I think that situation is going to go. So I'm always trying to remind myself to keep an open mind and not let what I think affect how that situation will go.
Awesome. What interests you about this job in particular?
Well, I really admire how many treatment options that you have for patients, and your patient population is huge. And so I'm really interested in working with a bunch of different kinds of patients. Your diabetic program, your diabetic exercise program, I think is really great. I'm all about healthy lifestyle choices and teaching others about how to make good decisions regarding health and wellness. And so I think that I would be a great fit for those kind of programs that you offer patients.
Okay. What experiences have prepared you for this job?
Well, so I've been on 4 clinicals through Ithaca College, of course, and I've been in 2 outpatient orthopedic centers and subacute/inpatient hospital settings. So I don't have any direct neurological rehabilitation experience, but I have worked with patient populations that you treat in this neuro clinic. So I've worked alongside a lot of diabetic patients, so I feel like I could be a great fit for that as well. So.
All right. Where do you see yourself in 3 and 5 years?
Well, I definitely want to become NCS certified. I think it would also be great to become lymphedema therapy certified. So I realize that you treat cancer patients as well, and so I want to expand my horizon through continuing education courses and things like that to expand my knowledge base on how to treat patients that you treat here.
Okay.
I definitely also see
fine.
myself working with this company too. I really admire the work that you do, and you've built this great facility, so I can see myself being here for the next years to come.
Okay, that sounds awesome. Do you have any questions for us?
Yeah, so I was wondering about your amputee patients. I saw that you offer home programs for them, so I was wondering if physical therapists who work for you go to their homes on a regular basis, or is that something that's not so regular that you try to treat them here in the clinic?
I can definitely get you some information on that. Is there any other questions that you have for us?
Well, I again, with the amputee patients, I saw that you're with them every step of the way, even prior to their surgery. So I was wondering if you're checking in with those patients throughout that process, or you just see them, after they get out of the hospital, after they're discharged home, or if we're checking up on them throughout the whole entire process, even prior to their surgery.
Another wonderful question, and I can get you information on that as well when this interview is done.
Okay.
All right, well, I think that's it for us.
Okay.
We'll get back to you as soon as we can. We hope you have a wonderful day.
Great. Thank you so much.
You're
I'm
welcome.
so happy to be here.
It was good to see you.
Good to see you. Thank you.